First, let's welcome Shelbourn Stevens of Novant Health's Coastal Market. Welcome back to the show again, Shelbourn. It's so good to have you here.
It's good to be here, June.
Yeah, it seems like every once in a while we have to do this. We have to get together and have these little chats. But I understand you have some very exciting news for me today, right?
That's right. I always have good news for you.
Yeah, you do. Some of it's better than others, but most of it's fun anyway. Well, tell me about it. Congratulations.
Well, thank you. I have a new title since the last time I did the show with you. So I'm now the president of New Hanover Regional Medical Center and the Novant Health Coastal Market.
That's a mouthful.
It is a large title, isn't it?
It is a big title, yes. So, well, how's it going so far?
It's going really well. It's only been a month that we've been into it, and but things are going well. I still have oversight of Brunswick Medical Center as well as Pender and Cape Fear Hospital as well.
My goodness, that is a big job. And
It's good.
I know the folks at Brunswick Medical Center were sad, but I know that they're as happy as I am for you. It's a wonderful opportunity, and we wish you the best. Well, today we're going to kind of take a look back because I can't believe it, 10 years since we opened that hospital. So I wanted to take a walk down memory lane.
Sure.
How's that? Now, I know you were at the old facility, as was I. So let's talk about the differences between the old Brunswick Community Hospital and the new Novant Health Brunswick Medical Center.
Well, the obvious thing is the size.
Yeah, obviously.
We only had about 70,000 square feet at the old hospital. It was all on one floor. And
right.
Everyone saw each other every day. And
that's true.
Now we're about 270,000 square feet, and departments are spread out over about 4 floors. And so you don't get to see everybody every day like you once did, but the team has gotten used to that over the years. And the old hospital, you had semi-private rooms, and it's all private rooms at the new hospital now.
And bathrooms.
Yep, everybody has their own bathroom and shower, and just large rooms as well, so plenty of room for your guests and family to come see you.
They're really nice. That was one thing that I do miss, is because we did know everyone, and you didn't meet someone that you didn't know, you didn't run into anyone. But I think we've adapted well, and when I was there today rounding, I saw so many people that I haven't seen in a while, but still we know each other, and it's more like family than...
It is. That community hospital feel has not gone away just because it's larger.
The size didn't affect the community hospital feel.
No.
So, yeah, I'm really happy about that. Well, I know that we moved patients and equipment and people and during that time. But tell me a little bit about how that occurred.
So it took a lot.
Yeah.
We actually hired an outside company to help us with the planning and the staging and the actual move. So the planning started about 8 months before the actual move. And then in a series of about 10 days, they moved everything, and they helped us line up with local sheriff's department and EMS and other transport agencies to move equipment as well as patients. And
some of those patients were so excited.
They were. They all wanted to be the first one in the new facility. And we had little gifts for them as they came into the new hospital, but we started at 6 o'clock in the morning.
I remember.
And we were done with the patients around 9 a.m. They were all in their new rooms.
New beds.
Yeah.
All new furniture.
Yep.
It was very foggy that morning. Remember that?
It was foggy that morning. I do remember it.
Terrible. It was terrible. It was so early in the morning, but I can remember the day before we moved, somebody didn't want to go home. They didn't want to be discharged.
Yes.
Because they wanted to spend the night in the new facility.
They did.
No, that was pretty funny. But is there anything during that move that surprised you or stood out?
No, just the excitement and enthusiasm about the move, and it was a well-oiled process. And we couldn't have 2 emergency departments open at the same time, so we had to stop services at one, open them up at the next. So it was a very staged approach to it. But just the enthusiasm from the team and the providers, and as you said, the patients.
They were so excited.
They were. And then moving to the new facility, we had the dining on call where you could call and order what you want, and they had their private rooms and private baths. We had a little problem getting some people out. They wanted to stay a few more days.
They wanted to lengthen their stay.
They did.
That's a good problem to have. Let's talk about accomplishments. What are you most proud of during those first 10 years at the new facility?
Gosh, it's going to be hard to narrow that down.
There's too many.
I would say overall it's just the growth of the facility.
Yeah.
When we first opened up, there was a couple of halls. We didn't open those
That's
beds.
right.
We didn't have the volume to do that. And today, we're struggling every day. We don't have enough beds, and we're holding people in the ED. So been able to recruit a lot of providers to the area, the use of telemedicine for those specialties that we don't have, adding a Da Vinci robot. Not many community hospitals.
Now the second one.
Not many community hospitals have those. Celebrating a few years ago, delivering 500 babies at 1 year was a big one. So it's just how much it's grown and how much we've improved the quality and safety. And we've been a Leapfrog A hospital for a long time now, and that's really hard to achieve. But the team continues to knock that out of the ballpark.
Yeah. It's funny when I remember giving a tour at the old facility and saying we delivered 9 babies a month.
Yes.
And now it's like 50. So it's not just a golf community or a retirement community anymore. There's lots of young folks here. Another thing we probably should talk about are hurricanes. It's hurricane season, so you've had some experience at that. That last one was a doozy.
Yes.
So talk to me about that, how you prepare for that.
So we have a well-written plan. The staff know it inside and out, and we start planning a few days before the storm hits, and then we have a team that stays there during the duration of the storm, and everyone sleeps on site. During Florence, I had a blow-up mattress and stayed in my office for 6 nights. But it's really a lot of teamwork. It's not that busy during the storm. And then once the storm passes and everyone can make it safely home, then another team comes in to take over. And that was the problem with Florence, is we had all the flooding, so it was several days before they could leave. But the team just really rallies together and does a great job to take care of the community during those storms. And we could easily close and say we're evacuating and not be here, but it's part of our mission to take care of the community, so we're going to be here during those storms.
Right. We treat everybody like family, as we treat each other.
That's right.
Like family, so you don't leave your family in times of crisis.
No, and we've had to stay there a few times in some ice storms years ago too, so
that's
just
true.
The opposite.
That's true. Well, let's talk about the future. What are you most excited about in terms of Novant Health and their future here and all over the place?
So now we're a large market here with the purchasing of New Hanover Regional Medical Center. And the good thing about that is being able to keep patients local, whether it's here at Brunswick or Pender. You know, we got the certificate of need approval for the hospital in Scotts Hill, so we'll start that build next year. And so having specialists available, whether it's boots on the ground here at Brunswick or telemedicine, to keep patients local. And then New Hanover is going to be there for that tertiary or quaternary care for the really sick patients.
Right.
Today they're full holding patients, and we send them a lot. We might only have one specialist in that specialty, and so they have to go up there. And I know several cases stayed in the emergency department up there for 2 days and then was discharged from there. So really just growing the services, and I see in the future building on to Brunswick Medical Center for more beds to keep up with the population growth that's occurring here. We're really going to be able to meet the needs of the community locally, so that folks don't have to drive that long distance, and grow services with the partnership with UNC. We're growing
that's amazing.
Yeah, we're growing the residency program. We're going to be growing pediatrics to be able to provide more services so folks don't have to go inland to a Chapel Hill or a Duke. But those great facilities are there for some of those services, burn centers that we don't offer, and some of those things. But really, it's just exciting to sit back and think about, look at what we're going to be able to bring to the community and the people of Southeast North Carolina.
Right.
And it's just really, really exciting. And also keep a focus on our not-for-profit mission. We still have that very robust charity care policy that really improved what New Hanover had. And it helps so many people. A family of 4 who has a household income of less than $78,000 and they don't have any insurance, they're not going to get a bill from Novant Health.
That is truly amazing.
It is.
I just had a conversation with somebody about that yesterday, and the fact that it's better now than it was for New Hanover, it's just amazing. So, well, thank you so much for coming today. It's always a pleasure to have you. Sometimes we laugh more, sometimes we but yeah, I'm so excited for you, and the best of luck. We wish you all the best at New Hanover. And
I'll be back.
You're not going to forget us. You're going to be back.
I'll be back. Talk about all the growth I just talked about.
Because you're over the whole market now.
That's right.
That's right. Okay, well, come back and see us.
I'll do that.
Thanks.